Welcome to today's webinar on optimization and validation of the Kairos amino acid kit in hospital laboratory. Before we begin, I want to share a few of the ON24 console widgets. You can move the various widgets around, you can minimize them. There's a resource widget where you can find key information on today's webinar. There's a speaker bio and contact information that can also be found on the console, and a certificate of participation will be sent automatically to anyone that stays on this webinar for 40 minutes or longer. Now I will turn it over to our moderator, Isha Chowdhury, to get this thing going.
Thanks, Nancy. And thank you so much to everyone for joining. I'm Isha Chowdhury. I am the Global Product Manager for the Kairos Amino Acid Kit, and it is my immense pleasure to be moderating our session today with our two speakers. First up, we have Dr. Marijn van Hoel. He is the Global Director of Clinical Applications and Support here at Waters. He oversees the clinical field applications, global escalations for chemistry products, method transfers, and is also involved in developing new application notes with our R&D team. Marijn joined Waters back in 2004 as an LCMS application scientist in the Benelux region, after earning his PhD in analytical chemistry from Ghent University. Next, we'll be hearing from Chiara Theron, who is a second-year master student in the McMaster's Medical Sciences graduate program. She is currently working under Dr. Murray Potter at the McMaster Children's Hospital to optimize and validate LCMS methods for biochemical monitoring in patients with inherited metabolic disorders. Thank you so much for joining, both Marijn and Chiara. We look forward to hearing from you today. I'll pass on the mic to Marijn now.
Good morning, good afternoon, good evening, depending on where you are. And thank you for joining this webinar on amino acid analysis, where Chiara and myself, we will talk about the chemistry and the methodology, and about the validation of the method in a clinical laboratory. It's my pleasure to kick off this webinar, and this is the outline of my presentation. I would like to briefly talk about the history of Waters amino acid analysis, then showing you the chemistry behind the amino acid analysis we have been promoting for so many years. After highlighting the advantages, I would like to finish off showing you some of the changes we have made to the original method in order to overcome some of the challenges we had seen. Whoever says Waters and amino acids in the same sentence actually automatically says Accutach. Accutach is the name of the Waters amino acid derivatization reagent. It exists since the 1990s and replaced Picotach as our derivatization reagent of the second generation. The main difference is that Accutach possesses faster reaction kinetics and forms a more stable derivative compared to Picotach. And it's that same Accutach reagent that is also used in MassTrack and Kairos kit for physiological amino acids. For long, Accutach was positioned for food and feed hydrolysates and cell culture media. It was around 2007 that Waters introduced the MassTrack AA amino acid solution. It was the first water solution for physiological amino acids. And although the methodology was based on UV, the mobile phases were MS compatible. But it wasn't until 2019 that Waters introduced an LCMS solution for physiological amino acids with the launch of the Kairos amino acid kit. The Kairos solution for physiological amino acids is available in a low and a high throughput version. The high throughput version is available in a manual sample preparation as well as an automated sample preparation version. These kit solutions, they all contain calibrators and QCs, internal standards, the reagents needed to reconstitute these CALs and QCs, and all the reagents, for sample preparation and derivatization, as well as the analytical column, mobile phase additives, the vials, and the necessary instructions for use either manual or automatic sample preparation. It's interesting to say that each component can be ordered standalone. The entire sample preparation procedure takes around 30 minutes for an average sized batch. The full name of Accutach, of which the structure you see here on the slide, is 6-aminoquinolyl N-hydroxysuccinimidyl carbamate. The carbamate functional group reacts very quickly with the amine groups, both primary and secondary of the amino acids. Although not relevant for MS detection, but the presence of this quinoline group makes the resulting product fluorescent, which enhances the sensitivity and the specificity of the detection. But we'll be talking more about MS detection. The resulting derivative is stable. Only one peak is formed for each amino acid. And as you will see on the next slide, the excess of reagent will not interfere. Now let's look at some of the reactions. It's important to understand that the derivatization takes place in aqueous solution, and I'll come back to that later. Shown here is the reaction of the Accutach reagent with a primary in red and a secondary in green amino acid. Even at room temperature, the reaction is very rapid, with half times well below 1 second. And this is the first reaction that takes place as soon as the Accutach reagent is added to the amino acid solution. Now, because of this derivatization, the derivatives have an intermediate hydrophobicity, which makes it possible to use reversed phase chromatography instead of Hillig or ion exchange. And again, I'll come back to that later as well. Finally, it's important to understand that the amines in this reaction should be in a neutral stage. This means that we will be working at an elevated pH 8 to 9, otherwise the reaction will become too slow. So on the previous slide, you saw the reaction that occurs upon mixing of the sample, the buffer, and the reagent. It is, however, important to make you aware that a second, albeit a slower reaction, takes place in parallel to the derivatization. In fact, water will attack the Accutach reagent to form 6-aminoquinoline, we call it AMQ, N-hydroxysuccinimide, and CO2. This means, in fact, that any excess of reagent that you will evidently have will be quickly destroyed by the presence of water. That also means that there is no need for a liquid-liquid extraction or anything else to get rid of the excess of reagent. A last reaction that occurs is the one between AMQ, which is actually also an amine, and the Accutach reagent, forming what we call bis AMQ urea, aka the derivatization peak. And actually the presence of this peak in the chromatogram is a sign that the Accutach reagent is still working fine. At Waters, we believe that Kairos amino acid solution comes with a number of advantages. At first, derivatization increases the hydrophobicity of the amino acids, and because it is happening in an aqueous environment, it allows for the direct use of reverse phase chromatography without the need to evaporate and reconstitute the sample. We use simple to prepare mobile phases, as you will see later. They do not file the MS source, and they are fully compatible with other applications that you would typically run on the same LC-MS system. Actually, what I mean with this is that the mobile phases will not negatively impact the sensitivity of other applications. The separation of all isobaric amino acid is baseline, except the separation between isoleucine and allo-isoleucine. But as you can see from the chromatogram in the bottom right, the separation will still allow adequate integration and quantification of the isomers. Some other advantages. You're all aware that amino acids are very small molecules, and obtaining good sensitivity with MS detection for very small molecules is not straightforward. So therefore, derivatization that increases the M/Z value of amino acids makes them more sensitive to analyze with LC-MS. Not often mentioned, but I think a very important aspect is that derivatization reduces the risk of contamination. It could be contamination through the skin in the lab environment, and serine and glycine being our usual suspects. The column is a standard column that fits in all ovens from all main UHPLC vendors. And the derivatives are stable for 1 week at room temperature, allowing retesting if that would be required. Now, having said that, within Waters, we are aware of the main challenges of this solution, and that is the difficulty to develop a good and robust LC method and the choice for a good column. The combination of the starting gradient of only 1% B in the original methods and the shallow gradient that needs to be applied in order to separate all these amino acids, well, that combination is very challenging for LC systems in order to guarantee, let's say, a stable retention time. Quaternary systems will have a bit more difficulties compared to binary systems, simply as a result of the difference in how the mobile phases are mixed. A second point that was addressed is that at high concentrations of amino acids, the cortex column that we originally applied showed some saturated peak shapes. Therefore came the idea to investigate alternative columns and gradient conditions. We screened a number of columns. The original MassTrack amino acid column, which is effectively an Acuity UPLC BEH C18 column, and BEH stands for Bridged Ethylene Hybrid, which was actually the first UPLC column Waters brought to the market, as well as 2 HSS columns, and HSS stands for High Strength Silica. And we also tested 1 CSH column, a charged hybrid column. And for your information, these are all C18 columns in a 2.1 by 150 millimeter format with sub 2 micron particles. Now, the acceptance criteria we used were to have sufficient retention time for the first eluting amino acid, which is histidine, and to obtain good separation for all isobaric analytes, in particular the 3 leucines. And very importantly, all of this had to be realized with an as high as possible mobile phase B starting gradient composition to avoid issues with retention time drifting in between injections. Now, the HSST3 and the CSH C18 failed this test for the reasons that you can read on the slide. However, the BEH C18, but even more the HSS C18, provided good chromatographic performance. So we changed the initial starting gradient from 1% B to 3% B. We decided as well to add some extra time post-gradient. First of all, for better column cleaning, but especially for better column reconditioning. So the original gradient changed into this new gradient, knowing that 15 minutes is still a very fast runtime. Here you can see the chromatograms of a selection of the amino acids, and from bottom to top you'll see the first eluting amino acid, histidine, then the isobaric amino acids, the methylhistidines, the alanines, hydroxylysine, the aminobutyric acids, and the leucines. And at the top, you'll see the 2 last eluting amino acids, phenylalanine and tryptophan, showing good resolution and good chromatographic performance for all. While we were optimizing gradient and column conditions, we equally thought whether we could optimize the mobile phases. We changed the original conditions, which was 0.1% formic acid in both the mobile phase A and B. We changed them into 0.2% formic acid in the aqueous mobile phase, while at the same time removing the formic acid from the organic mobile phase. This actually simplifies the preparation of the mobile phases and minimizes the risk of introducing a contamination. A remark that we sometimes received from our customers was that upon immediate injection of the derivatized sample, some amino acids, mostly the basic ones like arginine, showed peak fronting or even peak splitting. And when the same sample was injected the day after, the peak shape was good. Now, our theory is that the 20% acetonitrile that is in the vial as a result of the derivatization may have played a role here. And as soon as some of the acetonitrile evaporates in the vial, this detrimental effect is no longer observed. So what we did was a simple dilution of the derivatized sample with water, and this actually solved the issue. The additional advantage of this is that we can now use flat bottom vials to carry out the derivatization, because the final volume, which is now 500 microliter instead of 100 microliter, does not require inserts or maximum recovery vials. A last inconvenience that we tried to address was the difficulty of solubilizing the Accutech reagent. With the original 500 microliter reconstitution volume, the powder is not completely dissolved and needs repeated heating to resolubilize. For example, if you would like to use it the day after. When it is dissolved in 1 milliliter, however, this problem doesn't occur anymore or occurs to a much lesser extent. And obviously we have investigated but not seen any negative impact on the performance using this larger reconstitution volume. So in summary, you can see here the changes that we have applied to the original methods. And I would like to finish my part of the presentation by saying that the Waters product management team plans to include these changes as part of launching the next version of this kit. And with this, I'm more than happy to give the word to Chiara. I would like to thank you for listening.
Awesome, thank you, Marijn. So I'm going to jump into the process of clinically validating this method and how we've implemented some of those changes that Marijn has mentioned. And just a brief disclosure, I don't have any conflicts of interest to disclose. I'm a student at McMaster University and my funding is provided by Hamilton Health Sciences. So just to give everyone some context as to why the lab I work in is using this kit. So it has to do with a group of patients who have what are called inherited metabolic disorders. So we're focusing on those that are amino acid related. And what happens is a patient is born with some sort of mutation that affects an enzyme that metabolizes one of the many amino acids. And what can happen is you get a decrease in the products needed and also the buildup of certain toxic metabolites. So these are considered rare disorders with a prevalence of 1 in 10,000 to 1 in 30,000 live births. And there are about 70 of these disorders identified. They are also quite serious, so symptoms can range from general metabolic issues to neurological problems to deformities or even loss of function. Some of these disorders include PKU or phenylketonuria, maple syrup urine disease, MSUD, or urea cycle disorders. And the commonality is that they all require constant biochemical monitoring. And this takes place in the form of plasma, urine, and cerebrospinal fluid amino acid profiles. So now for amino acid monitoring itself and why the lab I'm working in has chosen to go with this kit. So you can generally group amino acid monitoring methods into 3 sections. So as Marijn was mentioning briefly, you have ion exchange chromatography or IEC methods coupled with UV-Vis spectrometry. This is considered the global standard or gold standard right now. We also have liquid chromatography methods, and then we have liquid chromatography tandem mass spectrometry methods. So that's the Kairos amino acid kit. We were originally using just an LC method, and now we're moving over to tandem mass spectrometry as well. And when we compare these, you can see why there is an obvious benefit to switching over. So starting with analysis time per sample, IEC methods can typically take upwards of 2 hours to analyze a single sample. LC averages around 30 minutes, and we are down to 15 minutes now, so it's much faster. In terms of sensitivity and selectivity as well, LC and SMS methods are generally considered high or excellent, where IEC methods can deal with issues like coelution and have lower resolution. And interference issues are also less of a problem with an LC-MS-MS method. And conversely, ease of use, it is a little bit more complicated to get an LC-MS-MS method started, but when you look at this all together, you can see that there's a clear benefit. So now for my project aims, my goal was to validate and implement an LC-MS-MS method for monitoring 45 amino acids in inherited metabolic disorder patients, and this happened to be with the Kairos amino acid kit. So I'll briefly go over some of the optimizations and changes we made, and then the clinical validation, as well as some details on the method comparison I've just performed. So this is very similar to what Marijn was describing. We reconstitute all of our calibrators and QCs as the kit recommends. We do perform a dilution of urine at this step. So we're reducing the volume of urine from 50 microliters to 25 microliters and increasing our water from 50 microliters to 75. Plasma and CSF are treated the same with the equal ratio of 50 IS to 50 urine, plasma or CSF to 50 water. We then derivatize as the kit suggests as well. So we've implemented that change of Accutag being reconstituted with 1 milliliter of the reconstitution reagent versus that original 0.5 mils. And then we also perform that dilution of adding 400 microliters of water to our final derivatized sample. Our sample is then injected into our system, so it goes through the column into the mass spec, and then we are able to detect. Some of the benefits of using a pre-column derivatization method was that it does enhance column retention, so that has led to better peak shape. It also increases column interaction, which we found has improved isobaric resolution. And as Marijn also mentioned, it improves ionization potential by increasing the mass of our analytes, so that's led to stronger signal and lower limits of detection. We also see a consistent fragmentation pattern. So all of our product ions have the same mass, and that's streamlined our identification. And we've also seen a reduce in matrix effects, which has led to more reliable and reproducible quantification. So this was the original method we were working with, which was published in the Kairos Care and Use Manual. And working with Marijn, we've implemented the optimization changes mentioned. So we've increased our formic acid concentration in mobile phase A from 0.1% to 0.2%, and that's to help with isobaric separation. We've also increased our gradient from 12 minutes to 15 minutes, and that's to allow for optimal column cleaning and reconditioning. Last year, when I started working with this method, I was using the bridged ethylene hybrid C18 column at 55 degrees, and we're now working with the Acuity high strength silica C18 column at 45 degrees. And we've seen better separation of our leucines, better retention of our early eluters, and less retention time drift overall. We've adjusted some smaller settings as well, including span. So we've increased that to 0.1 for every analyte, just to adjust for any shifts in mass spec calibration. And we originally had our sample manager at 10 degrees Celsius, but we've increased that to 15 degrees Celsius just to prevent sample precipitation. Originally, we also didn't perform a sample dilution, which we now do that 5 times dilution. And that's because we were seeing an issue called detector saturation in our high calibrators. So our peaks were looking like this. You can see it has a flat peak top when it should have looked something like that. And when we were originally processing the linearity, you can see this plateau at the high calibrator range. I've added in 2 additional calibrator points here just by diluting calibrator 7 to better visualize this. So I did a small optimization trial to figure out what is the best dilution level for us. And we found that the 5 times dilution level not only solved the detector saturation issue, but it also helped maintain and improve certain validation parameters like sensitivity. So you can see phenylalanine is shown here, and that linearity has been restored with the dilution. Then I moved on to the clinical validation portion. So this is Valine's calibration curve shown here. I won't go into too much of the methodology procedures I used for the validation, but I did follow the Clinical Laboratory Standard Institute manuals for all of these, which are listed below. So for linearity, I ran my cal curve, which was the 9 levels, the 2 additional ones added in triplicate over 1 day. and we performed first order linear regression analysis. And I did this with our calibrators, and I also did spiked plasma calibrators as well. And I found that 42 out of 45 of the amino acids met our R-squared cutoff of 0.975 or greater. In fact, most of them are close to 1, if not 1. And they established the expected linear range. We did find that phosphoethanolamine, gamma-aminobutyric acid, and 3-methylhistidine do have a slightly lower linear range of 5 to 700 micromolar. This is something we're looking to investigate in the future. I then looked at the precision of the kit. So this is a QC chart of leucine over the 20 days of experiments I ran. So to do this, I took the quality controls provided in the kit at 50 micromolar and 700 micromolar. I ran those 4 times a day, morning and afternoon for 20 days, and then calculated the coefficient of variation, or CV. And I found that all of the analytes in the kit reached our expected coefficient of variation of 15% or less. The low QC averaged at 5.43%, and the high QC averaged at 4.72%, which does indicate high precision. I then looked at sensitivity. So that's by taking these two formulas and calculating our level of blank and limit of detection. Our blank sample was a calibrator 0, so that only contained internal standard, and our low concentration sample was calibrator 1. I ran these samples 12 times a day for 5 days and then calculated these values, and all analytes had a level of blank of 1 micromolar or less and a limit of detection of 5 micromolar or less, which indicates high sensitivity. I then performed a verification. So within our lab, machine A is the Acuity UPLC H-class system. So that's what we performed all of the validation experiments I just explained. And we also have an Acuity UPLC I-class system. So we wanted to compare these and see how they were performing against each other. I do want to note the only change between the two machines is that for the H-class system, the gradient starts before injection, where the I-class system, the gradient starts at injection. So using those CLSI procedures, I performed a verification trial, which looks at precision and bias. So I took our QCs, ran them 5 times a day for 5 days, and looked at repeatability and total precision. The results were very similar. So as you can see on this table, the linearity aligns quite well. The sensitivity limits were what were expected as well. The precision for machine B, or the I-class system, was a little bit lower than what we'd hoped for, but we were also having some other maintenance happening on the machine as well. So it's something I will likely repeat just to verify again. And bias was expected and within our limits as well. I then looked at some stability. So we first wanted to see how the working stock solution was maintaining in fridge conditions, so 2 degrees. And the working stock is the internal standard, water, and calibrator mixture. So this graph here is glutamine's stability plot at 2 degrees Celsius. I did also look at glutamic acid, tryptophan, arginine, methionine, and histidine, and we used a 10% threshold or difference of degradation as a cutoff. So I did find that in the working stock solution, glutamine degraded past that 10% limit at 7.31 days in the fridge. So we don't keep our working stocks in the fridge for longer than a week, but the other amino acids of interest didn't show any significant change over the full 18 days. I also did a brief assessment of the reconstituted stock solutions. So that is the kit contents with hydrochloric acid. And I compared stability at -20 degrees versus -80 degrees. I looked at this over 30 days. And glutamine, again, did show degradation past our threshold at 15 days. So we store everything at -80 when possible. Most recently, I've looked at doing a method comparison. So these plots here are of valine in plasma, CSF, and urine. I compared the Kairos amino acid kit against the MassTrack amino acid analysis method. So this is what my lab was previously using. And I wanted to look at bias and method agreement for all of the amino acids that overlapped in plasma, CSF, and urine samples. So we looked at 98 plasma samples, 50 CSF, and 49 urine. Out of the 39, or out of the 45 amino acids, only 39 overlapped between the two methods. It's hard for me to make a general statement just because there are so many amino acids that we assessed, but generally we are able to move forward with refining our current reference intervals. And then for those that did not overlap, I will be collecting more data over the next couple of months to establish new reference intervals. And with that, the clinical validation in our lab is completed on both of our machines, and the method is ready for clinical use in monitoring inherited metabolic disorder patients. And with that, thank you for listening.
Thank you so much, Chiara and Marijn, for those excellent presentations. A quick note to our participants, so we have opened up the Q&A box. If you'd like to ask any questions, please feel free to add your questions there, and I'll voice them as they come up. So I see a couple of questions already popping up. We have a question from Ellie. I think this is for you, Marijn. When optimizing the mobile phases, what was the reason behind removing the 0.1% formic acid from mobile phase B?
The main reason was to minimize any source of contamination, or let's say to make sure that the mobile phase is prepared in the most easy way. So I compared the original 0.1 in both with 0.2 in A and 0 in B, also knowing that the highest percentage B that we need to remove the, to elute the amino acids is slightly, I think is around 15%, which means that you're never without any source of formic acid. So there's always enough there's always enough formic acid in the mobile phase A to compensate for the fact that there's nothing in B. But again, it makes it easier. The only thing you need to do is to open a bottle of acetonitrile, put it on the system, and there's no risk that you contaminate with any external source of amino acids. So that was the main driver. We saw no change in the chromatography. We saw as good sensitivity, and it is easier to prepare. So I think that's a win-win.
Gotcha. Thank you. Another question from Citi. I see that the 5x dilution improves the phenylalanine linearity and peak, but what about the other 44 amino acids? Does the dilution impact the other 44 amino acids as well?
Well, my main investigation was to see whether the peak shape was, let's say, improved. I would not necessarily say that a dilution will solve all non-linearity issues. I mean, linearity is mainly determined by the sensitivity of the analytes. So what we have seen, especially depending on what instrument is being used, because we position the Xevo TQD, the Xevo TQS Micro, the Xevo TQ-XS for amino acid analysis. But the more sensitive the instrument is, the more likely it is that you will reach saturation. Now, dilution will definitely always help, but in case it would not help completely, especially for those amino acids that go up to 4,000 micromolar, we've also tried working with the carbon-13 isotope of the molecule. So there's a combination of several factors that can increase the linearity. Dilution is one of them. Using a, let's say, a heavier carbon-13, for example, labeled, the carbon-13 version of the same molecule will help. So these two, and let's say also minimizing the injection volume, these three parameters will actually give you the best possible linearity. So it's a combination of different factors, not only dilution.
Gotcha. Kiara, I think this one is for you. Can you share which 6 amino acids do not correlate between your methods?
So right now we don't have data for glycylproline, homocitrulline, S-sulfocysteine, kynurenine, argininosuccinic acid, and phosphoserine. Part of that is just due to sample availability. So we didn't have many positives for amino acids like argininosuccinic acid. And then some of them just weren't offered on the Mass Track kit. So again, over the next few months, we're hoping to collect more data on those amino acids specifically.
Gotcha. And how transferable do you think this method is to other labs?
I mean, in my experience, just with training and talking to the members in my lab, it doesn't seem to be that different from what they were already doing. Of course, there are some changes. I've been working with some other labs as well. And, you know, aside from getting it started and initialized, the actual sample prep and methodology doesn't seem to be causing any problems or raising any questions.
Gotcha. That's good to hear.
Isha, what I'd like to add to this is that
Please do.
we have created a sort of information package for those people who use MassLink software to set up this application. So we have a default project that contains all the MS files, inlet files, tune file, processing method. So all of this data is available, and it will definitely help you in setting up this application. It has MS methods with open retention time windows so that you can easily identify if there would be a tiny difference in retention time. So I think this can help customers setting it up in a quick way.
Wonderful. Thank you for that note. Question from Anna here. What did carryover studies look like? Were there any issues with contamination of the needle or the injector at disease-relevant amino acid concentrations?
I think I'm going to pass on that question to Kiara. I think, Kiara, have you done this?
Not formally, but informally, we haven't seen any issues. We do add a couple conditioning injections at the very beginning and then after our Calibrator 7. Otherwise, everything runs through, and our QCs throughout long runs haven't showed any issues of carryover, and blank injections haven't either. So far it looks good.
That's good to know. Question from Alistair. Using the 500 microliter sample prep, is there any difference in samples injected immediately versus those injected 24 hours later?
Not that I have seen, because I've done the test where after dilution, I inject them immediately and I injected them again the same day. The peak shape was good immediately and it was still good the day after. Whereas if we would not dilute, what we did see occasionally before was that if we analyzed them too quickly, we did see some peak splitting, and we didn't see any of that. Well, I didn't see any of that when I diluted the sample. So that was a good observation.
Wonderful.
I can say as well, sorry, just to add, we've had to rerun samples the next day and haven't seen any changes either.
That's great. And with respect to the next version of the product, what I can say is that we will update the directions for use for this RUO kit to include these stability data points as well. So hopefully that should help the different contexts of your lab. Have we tested whether this derivatization works with acyl carnitines?
No. As long as these molecules are primary or secondary amines, it would work. But looking at the structure of acylcarnitines, I don't think that will work because they have to my knowledge, a positive charge on, it's a quaternary ammonium molecule. So I don't think that will be possible from a chemical point of view. I mean, the reaction between the derivatization reagent and the amino acid is actually a nucleophilic substitution. So you need an amine in its neutral state that will attack a carbonyl group. And as long as you do not have a amine group, it will not work.
Gotcha. Another question just related to the product. Is there a plan to increase the number of internal standards to minimize possible matrix effects? Answer is yes. We will be adding more internal standards than the current list of analytes. So hopefully that should help further minimize matrix effects.
It is worth mentioning here, Isha, that we apply a very significant dilution step. Actually, from sample to vial, there's a dilution step of 150. So this already minimizes significantly the matrix effects. So, but I can understand the more internal standards you have, the better it is. Yeah. But I just wanted to put it into perspective as well.
Wonderful. Have we tried this method on dried blood spots?
Me, not personally. I know, I mean, from our Wolters colleagues in Wilmslow, UK, they have done, still using the original method. So I can only think that combining their sample prep and this new method, that would not be too much of an issue. But that's
maybe an interesting app note to develop in the future.
Exactly.
Wonderful. And then Chiara, since you've gone through the validation of this method in your lab, have you seen any issues come up after machines have been PM'd?
Not particularly. We did have some shifts in our retention times as expected. We recently destacked our machine as well, so we had to play around with kind of our startup method just because our pressure limits changed, but it was nothing that didn't take a couple hours in the lab to figure out.
Wonderful. Interesting question from Anna. Is Waters starting a library of cross-reactive antibiotics that contain amides and may be derivatized?
I feel another
Have you
interesting
seen a request
coming up.
Have you seen any interest? Yeah.
No, but it's it's good to know. I'm also responsible for collating all customer requests regarding applications, so I'll see what I can do.
Wonderful. I will take one last question here from Tiro. If you use this method for IEM monitoring, how many amino acids from the 45 have the most important clinical relevance?
Most of them do. I'm not a physician, so I can't fully speak to that. I know amino acids like 3-methylhistidine and 1-methylhistidine aren't the most relevant, but amino acids like phenylalanine, tyrosine, those come up a lot, even the leucines, and they are used in our usual and consistent monitoring.
Gotcha. That's great. So what I would say is thank you so much, folks, for your questions. If you do want to reach out to our presenters, please feel free to do so directly. I'm sure you have many, many more questions for them. So please feel free to reach out to them directly. You should see their email addresses in the bottom part of your console. My address is on there as well. So if you have any questions, complaints about the product, please email me and we will discuss that further We also have a list of key resources available. So if you're interested in learning more about the Kairos amino acid product, you can find the list of collateral as well as Chiara's publication listed in that section as well. So thank you so much for all of your participation today. We've loved the questions you've had so far. For any follow-up questions, please feel free to email us directly. I'll hand it over to you, Nancy.
Concludes our webinar. Thank you everyone for your time and attention, and we certainly appreciate it. Have a great rest of your day. Thank you.